Hello, friends. I'm Ina Revutsky, a psychiatric nurse practitioner, and I have my dear friend, Dr. Marisol Brescia. She's also a psychiatric nurse practitioner, and we are here to talk to you about what depression looks like in young adults.
Hi, Ina. How are you? How you doing?
I'm pretty good. How are you today?
Excellent. I'm excited about this topic. It's a really interesting one.
So I wanted to invite Dr. Brescia to our conversation today because I have been getting a lot of people inquiring about what is extreme hardship for a U.S. born child. And when a family member is facing deportation, having a child with special needs or with certain medical or psychiatric diagnoses can actually be used in what's called extreme hardship. So, in order to prove an extreme hardship case, you actually have to have a diagnosis and a psychiatric evaluation. So, Dr. Brescia is going to talk to us about what does depression look like in young adults and in children. Go ahead.
So, Ina, you bring up a great topic as far as hardship with deportation and families. And a lot of the times, me myself, seeing it in the hospital in my own practice, I have children, starting at 5 years old that gets affected. Maybe one of their parents gets deported, or maybe the entire family gets deported. And how does that really look like? So it depends. It depends if you're a child, if you're an adolescent, are you mature enough? So I think in a child, we're talking about, let's say 5 to 10. At that age group, you see a lot of tantrums, a lot of crying, a lot of irritability. It's not classic textbook like you would see in an adult, like that isolation, withdrawal, or not finding pleasure in things that you do on a daily basis. It's more just kind of leave me alone, or it can be the other way, crying, not wanting to participate in certain activities that they normally like to do. So it really depends on the situation. An adult can now express themselves a little bit more verbally. They can actually say, you know what, this is what's affecting me, mom or dad. This is hurting me, the fact that we're going to be separated now. But again, finding the proper help, the therapist, if medication is needed, but the adult is similar to a child. However, they also have physical symptoms, right? In depression, sometimes they'll complain of stomach aches. I don't want to go to school. I don't want to go out to hang out with my friends. But that crying, that tantrum, it's not always because they're being defiant. It's let's ask to see what else is bothering them. In a smaller child, they're definitely going to be, pulling tantrums for sure. And that's when you want that open communication, with your child or adolescent.
So let me just understand this correctly. So depression looks different in different age groups. So a younger child will have more of a tantrum because they have less language to describe what they're feeling. So they'll just throw a tantrum, they'll scream, they're not going to want to, like you said, participate in activities that they like to do, or they'll just kind of cry and be difficult.
Absolutely.
Then the school-aged kid is going to present a little differently. They will refuse to go to school. Maybe they will isolate, sit in their room, or not want to participate with their siblings. And then the older adults who have the language, who have the emotional maturity to discuss their feelings and emotions, it will look very different in the older population.
Absolutely. You're absolutely 100%. And I think those are the missing parts when we learn about depression, or when someone looks up depression in Google or ChatGPT. It's very textbook. But I do believe, and the research shows that in different age groups, they present slightly different. Overall, they have very similar grounds, but very specific to the age group. So you're absolutely correct.
And from your experience in working with children and young adults, and of course adults as well, how do you approach when parents bring in a child or a teenager? How do you approach the symptoms? How do you work?
Well, first of all, communication and building a rapport with the little ones, especially. trying to get them to even talk or even describe. Sometimes they're like, I don't know. So you want to kind of win them over. As a child, working with children, I do have toys in my office. So I kind of bring them over, trying to high five them when they're answering proper questions. I let them play with toys. And then again, I ask them very simple terms. Does your stomach hurt? Does your palms get sweaty? Do you have friends? Do you like to play with your friends in school? Do you like your teachers? Right? We want to build a rapport to see if they're able to communicate with them if something is bothering them. But overall, it's very difficult for them to answer certain questions. So of course, you also have to build that rapport with the parents. The parents definitely want help because they're at a point where something is going on. They know that they're being affected one way or another. So they are coming for help. The adolescent, they're much more open, very, very open to communication. Almost they want for me to explain to the parent how they're really feeling. So I'll just support them and say, so-and-so, this is a safe place to speak. I want you to speak or describe what you're feeling to your parents. And I'm here to guide you both, but allowing both sides to understand each other.
And I also wanted to ask your advice. So if a child or, a teenager who is suffering from depression, from a diagnosed, not just an episode, they're not just kind of sad because, they had a fight with their friend, but they're really clinically depressed. What would happen to a child like that if they had to be deported, if they had to move to a place like Venezuela or Mexico or, Brazil? What would happen to a child like that if they had to leave their comfortable environment in the United States and abruptly move across the world to be with, to follow their parents?
So really, we encourage the families, if they know that this is going to happen, even if it's going to happen abruptly, find even a psychologist. Even if you don't find a psychiatrist or a nurse practitioner, get a therapist on board so that they can process their feelings. In the meantime, try to find someone that can prescribe the medication if they are on medication. Because now we're talking about clinical depression and it's not a single episode. So that may warrant more of a medication along with therapy. But if they're abruptly leaving, I know there's a lot going on in that household, but you at least want to find a therapist or find someone that they can confide in the meantime, because it's a lot of changes and you definitely want to process that.
Yeah, so I do see some of the folks who are facing deportation. For example, mom has to get deported and the child would stay behind with the father, with the grandparents. These are very difficult decisions that families have to face right now in the new immigration world that we're dealing with. What happens if the support structures are kind of taken out of the equation and the child is left behind with maybe grandparents?
Well, that's a hard situation. It depends how close are they to whoever's they're staying behind with. Usually if it's the parents that are being deported and they are the person or the people that they're always with and don't really confide in your aunt, your cousin, or whoever's staying behind, unfortunately, it's going to be such a difficult road, but they're going to have to find extra support, meaning outside support, for better understanding. Why? Because even the family that they're with can be supportive, but they're also struggling too. They're also trying to process. Now they have to take care of other children or other people. Now they have to worry what's going on in the other country. Are they okay? When are we going to see each other again? So I think always finding help, extra help outside of the household may be beneficial for not just the child, but whoever's taking care of them as well.
And how quickly can somebody's, simple, mild depression spiral into something, more serious? And what do parents really, or parents or caregivers really should pay attention to?
Well, to be honest, a stressful event can be traumatizing, and separation from a parent or a close family member can be just that. If you know that that is a possibility, I would start the process right away, again, in getting the proper help, to prevent, because you want to process those feelings. Everything is about communication and letting it out. Once you allow that communication to come out, it's almost like you have some relief, but you also want someone to understand you, be there for you, be relatable. However, that process has to happen immediately. It has to happen immediately. Unfortunately, again, there's everything going on. You may not think that this is important, but you can start seeing the withdrawals, the crying, the separation, not wanting to be with friends, not want to be bothered, doesn't want to go to school anymore. Some of them have romantic relationships. They stop texting. It's really hard for a child to go through something like this, and it can turn into a traumatic event for them.
And what are the symptoms of severe depression? What is something that you see clinically in severely depressed kids and young adults?
Okay, so you see a lot of guilt, worthlessness, low self-esteem. They're having difficulty sleeping, difficulty with appetite. Sometimes they move slower than usual. Sometimes they move faster than usual. But all of that can spiral into having negative thoughts of hurting yourself. Sometimes children, young adults start self-harming. That's how they've relieved the pain.
What's a self-harming? Explain what self-harming is. A lot of people may not know what self-harming is.
So self-harming means pulling their hair. It means picking at your skin. It means grabbing a sharp object and cutting your forearms, your thighs, your back. It's basically inflicting pain on yourself. It's really difficult to describe, but if you speak to a child, they will tell you, I'm inflicting pain to release pain. And that's a really difficult concept, but they do it so that they can feel, because a lot of them describe their feeling as feeling numb. So relieves that. They now feel something and it's painful, and they may say, I don't want to do it again. And some, they leave really, difficult scars that they have to face. But at that moment, they're thinking, how did I get to this point? What can I do? And self-harming, inflicting pain on themselves is what relieves their pain. So we have to definitely watch. A lot of my teenagers, when I go, I say, can you please lift up your sleeves? I'd like to see your forearms. If they have shorts, I check their thighs a little lower. I ask them questions. Are they using drugs? Sometimes they refer to drugs as well. So they're inflicting pain. And inflicting pain is very different than suicidal thoughts. Suicidal thoughts is now, I'm Googling ways to die. What can I do? Okay. And then that can lead to an actual attempt of suicide, actually performing what your thought was. So we have to be really vigilant on all these symptoms and be observant.
And so you're recommending that parents are observant, but what happens if the kid is sitting in the room and they're gaming and they're they're kind of self-isolating? Can you just give like simple tools how a parent could easily approach their maybe teenage daughter or teenage son to really like enter their world and help them deal?
So I think parents always say, oh, but they're doing something. I'd rather them be home and game all day than be outside where I can't see them. Well, that's also a symptom. Everything in moderation is okay. But now if you notice excessive things going on, such as gaming all day, they're trying to distract themselves. However, you want to keep them proactive and busy doing other things. Let's work on something together. Let's do a family activity. Take them outside completely as a family, or spend some alone time with that person. But really, when someone is gaming or on their phone or watching TV, are we really watching our children 24/7? We're not. We don't know what's going on that other side. We don't really know what they're thinking. So again, communication, speaking to them, but being observant of what they're actually doing, and maybe limiting time. You know what? You can game for an hour or two, but after that, let's go walk around into the park. Let's go ride our bike. Let's go take a walk to the mall. Let's do a board game. Let's play cards. Let's do something as a family. Let's go have dinner. Help me cook. So you want to have them engaged, right? Don't do everything alone, but you want them to be engaged in activity so that they're not so focused on just one thing that can potentially be detrimental.
And that brings us back to the conversation of a parent, one parent or both parents facing deportation. They really would not be as involved in the child's life, and therefore it would harm the child, whether they're mildly depressed or severely depressed. This would really negatively impact them, because the stress of the whole family places so much more stress on an already vulnerable child. So when we're documenting this in the psychiatric evaluations, we often make sure that our clients, in this case, young adults or children, they would be safe, because safety in psychiatry is number one. And of course, when I see kids who are not safe, I refer them out. I refer them for medication management, for therapy. I refer them to people like Dr. Brescia, because she is very experienced. She has a practice. She's worked with kids for several years. So I will provide her contact information. She's a great resource for me. She's a great resource for my patients, because she is so knowledgeable. I really want to thank you for coming here and just having a quick chat with me about what depression looks like. Again, it may not look like much because the kids are on a computer, they're gaming, but you just never know if they're researching topics, how to hurt themselves, if they're communicating with, with other kids in these, virtual groups where they could all hang out and get information. So again, if the parents are not in the picture, if mom is not in the picture, if dad is not in the picture, because they're being deported, because they're facing, hardships as a family, as an immigrant family, it places these kids at much greater risk. And this is where we come in and we help document all of that and hopefully prevent deportation, because of course, an extreme hardship would be on a US born child. So I want to thank you for coming in and having a conversation with me. I will provide your contact, and I look forward to talking to you in the future about other topics.
It was a complete pleasure, especially speaking about such a sensitive topic during these difficult times, for sure. Thank you for having me today.
Take care. Thank you so much.
Take care.
Take care.